Hi, everyone. Welcome to today's Research America Special Alliance discussion, and it's a continuation of our series highlighting our 2023 Advocacy Award honorees. The Advocacy Awards are being held on March 15th, and we hope you all can join us. And thank you so much for joining us today, and for our Alliance members, thanks for your partnership. Today, we're really excited to be joined by the recipient of the Geoffrey Beene Foundation Builders of Science Award, Dr. Helene Gayle, who is the president of Spelman College. Before we get started, we have a great video highlighting Dr. Gayle's accomplishments. And I'm wondering, we're having a technical problem.
Hello, thank you for joining us in recognizing Research America's 2023 Advocacy Awards honorees. Our awards honor those who have made extraordinary contributions to the progress of medical and health research. It is my pleasure to introduce Dr. Helene Gayle, who will receive the Geoffrey Beene Foundation Builders of Science Award.
The award shines a spotlight on those who have committed to advocating for research by building and supporting an outstanding research institution. There is no more deserving individual than Dr. Helene Gayle, this year's recipient.
Dr. Gayle, the president of Spelman College, is a public health leader and humanitarian with a career dedicated to eradicating inequities in health and wealth, including in her roles as past president and CEO of the Chicago Community Trust and of CARE. She also spent more than 2 decades in a variety of roles in global and national public health at the Centers for Disease Control and Prevention and at the Bill and Melinda Gates Foundation. We look forward to hearing more about Dr. Gayle's work.
Because I started my public health career and journey in federal government working for the Centers for Disease Control, I got involved and exposed to public policy very early on.
Dr. Gayle saved millions of lives through her science and advocacy during the HIV/AIDS crisis. She's been a global leader in that area, as well as in tuberculosis and sexually transmitted diseases.
I just try to stay as close to the work as possible so that I stay motivated and I remember why I went into this work to begin with. I have always felt that it is important in anything that I'm involved in to be an advocate as well as a practitioner. Without advocates, practitioners of whatever their craft may be are not always able to realize the impact that they want to have.
She is a remarkable leader in science and in advocacy and has literally put those two together in a seamless way.
One of the things that I firmly believe in doing advocacy work is making sure that you build the partnerships and the network. We may have an issue that we're advocating for, but we need others to also work alongside of us. So I think one of the things I always try to stress in advocacy is don't do it alone.
Dr. Gayle, congratulations on receiving the 2023 Geoffrey Beene Foundation Builders of Science Award.
That was a terrific video. And Dr. Gayle, you've done some amazing things. Congratulations. And I'm very happy to turn this over now to our moderator, Dr. Michelle McMurry-Heath, who is a R&D industry leader and a Research America board member. So Dr. McMurry-Heath, over to you.
Thank you so much, Sheila. And thank you all for joining us. Today, we're so excited for this conversation. The Geoffrey Beene Foundation Builders of Science Award recognizes those who have provided inspiration and determination in building an outstanding home for research. And Dr. Gayle, it's such a privilege for us to present this award to you this March. You're a pediatrician and a public health leader, and you have invaluable expertise when it comes to economic development, humanitarian health equity. So what would you say are some of the key influences or factors in your life that really drove you in this public health equity world?
Thanks so much, and it's wonderful to be with you, also a public health and health shero. So it's great for me to have the opportunity. I guess when I think about why I do what I do and what were some of the influences, I always knew that I wanted to have a career where I could give back and make a contribution. And, for me as an African-American woman, I grew up seeing disparities around me, in the community that kind of nourished and shaped me. And I always knew that I wanted to, in some way, make an impact around these issues of inequity. And so, I grew up in a home where my parents felt that getting an education was kind of fundamental and critical. All of my siblings and I have, were exposed to people who had careers. We grew up in kind of this tight-knit African-American community in Buffalo, New York, where, a lot of my parents' friends were lawyers, judges, engineers, and we saw excellence and realized that there was a lot that could be done, but also from this standpoint that I was kind of a student activist. I was involved in, all of the things, the issues of our time, whether it was the civil rights movement, women's movement, anti-apartheid, all these things were very much a part of who I was growing up, and being exposed to a community where, we were this notion of to whom much is given, much is expected. We weren't wealthy, but we had the ability to get an education. So all of that, my kind of social activism coupled with my education and being from a family where that was hugely important to go back and contribute, I just always felt I wanted to have a career that made a difference. Health, critical, fundamental to everything. And so I chose medicine. I felt from a practical standpoint, that was a career where, you will be able to meet your bills and pay your mortgage, but it's also something that gives back in a fundamental way. I ended up kind of pivoting from individual care as a pediatrician to public health, because again, I always had this sense that I wanted to be part of movements, part of something bigger than myself. And so public health seemed to be that wonderful blend of your medical background and experience, but looking at a population as your patient versus an individual. And I just felt public health was the way of really focusing on broader population level impact and ways that hopefully I could impact some of the inequities that we know make up our health landscape.
Amazing. I'm curious, particularly after seeing that video, you've had the opportunity to kind of see the trajectory of how we've tried to alter and change our ability to use health diplomatically and also as a tool for equity. How have you seen the field change in your career?
So, if I think about public health and some of the big public health challenges that we have grappled with, one of the things that I really think has been a positive movement in public health overall is understanding that we are going to have an impact on health disparities if we think not in a narrow public health box or a narrow medical box, because increasingly we know that the issues that make that cause the greatest disparities are not just impacted by health interventions. It's not just about whether you take medicines or whether you get to your practitioner on time. It's about the life you lead, whether or not you have access to economic opportunity, whether you have access to a good education, whether there's a grocery store that sells fresh food that's within reach, whether you have opportunities for exercise. So, all these things that we are now calling the social determinants of health, I think to me, that's one of the real positive movements in public health is recognizing that health is not just about health interventions. It's about how you live your life and what access you have to the things that allow you to have a better and healthy life.
That's wonderful. So, it's interesting. Now you've taken on this new role in leading the preeminent HBCU, or historically Black university or college for African American women, and with a huge emphasis on STEM. Can you tell me a little bit about how you're seeing the intersection of your broader career trajectory and this opportunity?
Well, as I like to say, at this stage in life, where so many of my friends and colleagues are kind of going off into the sunset, and that this is the time of life where you give back to the next generation. And so I feel really fortunate that I have had a career that has spanned health and medicine and economic well-being globally and domestically. But I really do feel like this time in my life, I want to give back to the next generation. And I want to be able to use the experiences that I have to fuel the next generation of young Black women who are change makers. And so, I think broadly speaking, liberal arts educations are important because they teach young people not just a specific skill, but they teach young people how to be lifelong learners. And if you can be a lifelong learner, which all of us have, shifted and morphed and done different things, then that's when you really change, being able to leave to the next generation the ability to solve today's problems. As you mentioned, Spelman is a huge producer of young Black women who go on to do STEM careers in STEM. Biomedical sciences and health careers are always way up there in terms of what our students want to do. So I'm excited to be able to help to foster the next generation of young women of African descent across the board, but particularly excited about how young women are recognizing that STEM careers, from healthcare careers to computer science to engineering, are really a lot about the careers of the future. And I'm glad to be at a place that is producing them.
It's wonderful. So you arrived on campus, I think, this summer. I think when I saw you in the spring, you were getting ready to start off. What have you seen as you've come back to campus? How have campuses changed? How have the students changed? What are you observing?
Well, since I was a student, there's this thing called the internet that I think has changed our whole world. As we all know, for better or for worse. Now anyone who wants to can send a message to their college president and complain about whatever, and they do. But we also realize how much the internet has opened up the world of information. And I think that's huge. And I think we have to keep thinking about how do we use that and harness it for good. And, internet and social media has its flip side. So I think the self-esteem of young women is influenced by what's going on around in the internet, and some of it's good and some of it's not so good. But I think that's the biggest differentiator between when I was a student and I had to call my parents collect to ask for ask for something. Today information is everywhere, connectivity is everywhere, and I think we need to keep thinking about how do we harness it for the good, and really look at some of the ways in which I think it has not been positive. And again, I think about self-esteem issues, mental health issues, that I think this sense of seeing people with idealized views of this is what it means to be a young woman at 20, and if you're not that way, what does that mean for you, and how much pressure does that put on people? But that aside, I think the information age is what is changing all of our lives in ways that are I think pretty incredible, and I think we need to figure out how do we make sure it's a plus and not a negative.
So, you've had a career inside of CDC and the federal government as well. And one of the areas of focus for Research America is how federal research funding impacts not just the production of science, but the production of the next generation of scientists. And so I'm curious how Spelman is thinking about NIH funding and other sources of federal research support. Has it changed recently? What's your agenda from that point of view?
Yeah, so, I think the sky is the limit. And there's so much more interest these days in having diversity within the science and clinical trials and, research in general. And so, Spelman is the top producer of Black women who go on to get PhDs in STEM fields. We need to continue to do more, because, by the way, when you say the top producer, the bar is fairly low because we have not had the kind of diversity in the STEM fields, and particularly in the research field. So, I think we want to continue to increase, and it's great that we're seeing more role models now than I think young women had before. Everyone talks about Cosmicia, who was the NIH researcher who worked on the COVID vaccine. It's tremendous to have young women see somebody close to their age who is doing it. And we've got to continue to make sure that we're putting role models up there like Cosmicia Corbett, who, was such a bright light during the COVID pandemic. But I think more and more young women like that who show that research is a cool career, and that you make a big difference in people's lives when you're able to do something like help to create a vaccine. So, I think we want to do more of that and really think about where are there opportunities to make sure that young people, young women particularly, appreciate the value of a research career.
Wonderful, wonderful. Well, there's such power amongst the HBCUs and amongst our universities and colleges in general. And you mentioned social determinants of health and how that's really changed during your career. How do you see our research and learning institutions coming together to have an impact in this area that's so critical?
Yeah, I think there's so much that HBCU, along with predominantly white institutions, can do together. And I think that's where I really am optimistic and see a lot of move forward are these partnerships. Sadly, HBCUs punch well above their weight, and that's not the sad part. They punch well above their weight, but the reality is it is with limited resources. And, so on one hand, I think we've got to do a better job of making sure that HBCUs have the resources that they need to be able to not always just punch above their weight, but be able to have the resources to continue to have the impact that they have had. But in addition to that, I think, having partnerships, stable partnerships with predominantly white institutions where there are greater resources. And so, for instance, we have a lot of programs at Spelman where, as a Spelman student, if you have a certain grade point average, interested in certain careers, you can do 3 years at Spelman, 2 years at another institution and get a master's degree, or, a 3-year program at Spelman, go on, get a medical degree. And so I think more and more of those kind of partnerships where young women are able to come to a place that nurtures and supports them, but they also know that there's a path forward and a partnership with a major research institution, which Spelman is not, that allows them to then further that aspect of their career. And I think the more we can do that, the better we will be in terms of the pipeline of, more diverse pipeline, a pipeline that is really bringing forth students. So I think there's a lot of win-win situations there by creating those kinds of long-term stable partnerships.
Wonderful. I'm going to give a prompt to our audience that we're going to be taking audience questions soon. So please start generating and adding those questions to the chat, and I'll be sure to make sure we pull those in as well. But before we do that, you mentioned resourcing of the HBCUs. Can you talk a little bit more towards that? And have there been recent changes, or do you see a change in how the HBCUs, particularly Spelman, are approaching endowments and supporting students in your teaching activities?
Yeah, so, I think the biggest challenge for most HBCUs is that our endowments are nowhere near what predominantly white institutions are. And as everyone knows, the endowment is what gives you the flexible resources. And so we're fortunate that we have many scholarship programs, for instance, that allow us to provide scholarship to students. But they're specific scholarships. We have a lot of resources from donors for particular programs. I give as an example one of our global learning programs that is well endowed, but the focus is on global learning, which is great. And I could go on and on about the kinds of programs that we have that are very specific to areas, all areas that we want to do more in. So love those, and great that we have them. On the other hand, an endowment is what gives you the flexibility. It's what gives you the ability to plan long term. And, there's lots of comparisons that have been written about HBCU endowment versus PWI endowments. But as an example, if you put together the top 10 HBCUs, I think the total endowment is about $2 billion. If you put together the top PWIs, the total of the top is somewhere like $100 billion. So, you just can't, it's hard to compete. And we know that, a lot of HBCU graduates often, were not necessarily going into fields where they're or able to go into fields where there was huge economic compensation. So our alumni base doesn't necessarily have the ability to provide support like the alumni base of predominantly white institutions. All that to say, we know that there is a great disparity, and that as we're able to continue to build our endowments, we will be able to continue to do some of the things that are making such a big difference at a time when America needs diversity and diverse voices more than ever. And HBCUs are an incredible source of supplying those diverse voices at schools where students go and are encouraged to believe that they can do anything that they want to do in life. And so, HBCUs have a special formula, a special sauce, and we need to continue to figure out how we provide more support to HBCUs.
Are you continuing to see excitement and mobility of kind of corporate partners to universities and continued interest in diversifying the workforce? And if so, what role do you see institutions like Spelman playing in that?
Well, we have wonderful corporate partnerships. And, as a result of many of those corporate partnerships, which provide scholarships, provide internships, and ultimately provide jobs afterwards, it makes such a huge difference. And, I could go on talking about scholarship to scholarship programs, but they make such a huge difference, I think. And again, I think, as we as a nation appreciate the fact that having diverse voices at the table is what will make all of us better, these are the kind of partnerships that I think make a huge difference and allow us to do more than we would otherwise.
So let's talk about the difference it could make. If you were going to redesign from scratch a more equitable healthcare system, what would it look like? What would your ideal be?
So I think, first of all, a health system is a multifold enterprise. You have to have, make sure that there's diversity on the supplier end as well as on the user end. And you have to make sure that all of that works on behalf of the individual and on behalf of the community. So, I think if you look at every aspect of what goes into healthcare and the health service industry, do we have accessibility? Are there places that people can go that meet their needs and are close to the communities, and that have hours and times that fit the needs of working individuals, particularly working individuals who oftentimes are daily, hourly wage earners who can't just say, I'm going for 2 hours to the doctor's appointment. So do you have Saturday clinics? Do you have Sunday clinics? Do you have after 5 clinics? Are the prices affordable? Are there payment arrangements? And we could talk on and on about healthcare insurance and payments, but are we thinking about access from a payment standpoint? Then are we thinking about who the providers are so that people are being met with and greeted and taken care of by people who they trust? Because we know that there's a huge trust gap in our health system. So are we making sure that we have providers that reflect the communities, or at least are culturally competent to work in the communities where the health needs are greatest? And then finally, are we linking health to public health more broadly and prevention? Because often when we think about health access, we're really thinking about disease treatment access, which is very different than thinking about, are we looking holistically at keeping people healthy, which includes having grocery stores in neighborhoods, having safe places to walk and exercise, education that allows young people. We know education is one of the biggest determinants of health outcomes. So, we need to think both about, do we have the right systems for treatment and care, the right providers, the right proximity, and then are we thinking about the other things that impact one's health? Because we now know that the social determinants of health have a greater influence on people's health outcomes often than access to care.
Wow, amazing. You mentioned, our job as science leaders of making science seem cool. Could you say a bit more about how we should do that, and what are you finding that works with this upcoming generation?
Well, I do think seeing more people who look like the generation makes a big difference. And so I think the more we are showing some of the health champions that are, young Black women, people of color, showing the diversity of health professionals, and that you can be anything you want to be. You can create a COVID vaccine. You can be part of a team that produced a COVID vaccine. You can be part of teams that are finding cure for cancer. You can also be a community-based health worker who is making sure that elderly patients get to their healthcare appointments. You can be part of a teen health group that is making prevention cool for young people. So we want to make sure that people are seeing the whole range of ways in which you can be a healthcare worker without necessarily being a doctor, a nurse, or a particular health profession. Healthcare and public health is all of us, and all of us need to feel like we are part of that enterprise. And I think we need to just keep showing young people role models so that they understand I could make a difference in the health of my community as well.
I love it. I love it. Well, I know we have quite a robust audience online as well. If you have any questions, please type them into either the webinar chat, preferably, or even the chat line, and I'll try to make sure that we get to them, because there's so much going on now. You mentioned mental health of this generation a little bit earlier. Could you say a little bit more about that? Because I am hearing that topic come up more and more as our kids are emerging from the pandemic and venturing out into their careers. So say a little bit more about what Spelman has been seeing and what you think might help and assist.
Yeah, so we're seeing a lot of mental health challenges, and I think it's multifold. First and foremost, I think this generation is a generation that has grown up in environments that are stressful, whether it's the impact of climate change, COVID, racial reckoning, divisive politics. This is a generation that is growing up seeing lots of challenges right before them, and that's the only world that they know. I can look at a lot of these things that are challenging and frightening, but I've seen other things. This isn't my whole orientation. So for a lot of young people, I think growing up in these times that are, very challenging gives them a certain context. I do think that, we talked about before, for better or for worse, I think that internet and, access to information has been hugely positive, but I also think that there are some negative aspects that have been talked a lot about. What does social media particularly do to people's sense of self-esteem? We know that there's bullying going on. We know that people are comparing themselves unrealistically to, what is seen as the ideal. So I think there's that whole range of being so actively involved in comparing oneself sometimes to unrealistic images has had a negative consequence. I also think that, again, with the information age, young people are, the competition is getting so much stiffer, and, everyone is seeing themselves compared to someone else. Jobs are getting more competitive, the job landscape. So all of those things, I think, are leading to a certain amount of fragility, and young people not always having the grounding that allows them to have a strong sense of self. So we're seeing it on campuses. When I talk to my colleagues on other campuses, they're all saying that this is a group of young people that seem more fragile, that need more support. I think the other thing is this is a generation where talking about mental health challenges is no longer the taboo that it used to be. So I think they're also talking about these issues more. And I think we've got to continue to think about how are we giving young people the support that they need, the grounding that they need, allowing them to be themselves without feeling like they have to measure up to some particular standard of, what's standard of beauty or standard of accomplishment or what have you, and continue to figure out how we give young people a sense of security, even while these times are, in some ways particularly insecure.
Mm-hmm, mm-hmm. Well, to that point, we have a lot of early career researchers on the line with us today. And I'm wondering, what's the best piece of advice that you received early in your career, looking back? Or what piece of advice would you have given to yourself now, looking back?
Well, the piece of advice that I would have given to myself, and it's what I try to give to young people, is don't feel like you have to be perfect. We all make mistakes and learn from them, because mistakes are your best teacher. Don't be afraid to make a mistake. I also think giving young people the ability to say no. So as an example, on our campus, when I talk to the average young person, they've got one major, often two minors. They're involved in 6 different extracurricular clubs. And I had a young woman come to my office and say, Glee Club takes a lot of my time, and I'm not even sure if I want to be in Glee Club. And I said, it's okay, don't be in Glee Club. I think giving young people the ability to take some of that pressure off. You don't have to be perfect. Prioritize the things that are most important to you and truly give you joy. Don't do them because somebody else says you should do X, Y, and Z to get into this school or that school. Do the things that matter to you. Do the things that give you joy. And then I think you're going to be a lot happier along the way.
It's wonderful. And do you have any advice for first generation college students? Because that's its whole entity as well. So I'm just curious about that. And I'm sorry, I'm reading chat as we're going as well. So I have another question coming up for you after that.
Well, I think the biggest thing for first generation students, which means oftentimes they have not had a role model in their own family about college, is to make that have not had the college experience themselves, is to make sure that you are taking advantage of what schools have to offer in terms of counseling, but also getting to know students who are both other first generations, so you can share the journey, but then other students who, perhaps are legacy children whose parents and grandparents may have gone to the school, because that also gives you a different orientation. So, I think the bottom line for first generation, reach out, don't feel like you're in a situation by yourself. There's many others. Take advantage of the resources, and you're there for a reason. You can be what anyone else can be, because everybody was first generation at one point in time.
I love that. Great. Well, we've got a question in the chat that diseases that are prevalent in communities of color need better medications and drug discovery, yet there's a lack of diversity in clinical trials. So despite the past complexity of poor experimentation to African Americans, what are your thoughts to educate our community in higher participation?
Yeah, great question. And it's an area that I and others have, worked on for a long time. Going back to my days in HIV, when we saw that the clinical trials were incredibly non-diverse. And, we have a history of clinical trials in this country that is tainted with clinical trials that were done in negative ways, and particularly for people of color. So I think first and foremost, there is a real need to continue to heal the breach, to continue to be trustworthy, so people feel like, we have a health system that they can trust. And I think it's so critical when we think about getting people, and particularly people of color, enrolled in clinical trials, to have people running those trials that look like them, that they can trust, that they feel have their best interests in mind. So, I am a firm believer that it is critically important for us to be part of clinical trials. It's part of making sure that they're valid. It's part of making sure that we understand whatever physical differences there may be, but also, it's a fairness issue. It's about getting access in ways that we have oftentimes not had access. So I think it is, building trials in ways that take that into consideration, and critically to make sure that researchers and community organizations that are oftentimes partners in clinical trials are there and show a face that makes people feel like they can trust the research that's going on. So trusted messengers, right. I think, an incredibly important part of it, and making sure that the clinical trials research enterprise prioritizes this and makes it very clear the importance of having diverse subjects in clinical trials.
Perfect. Well, we've got two last questions in the chat that are going to be a great way to round out our conversation. The first is, what's the biggest overlap between your medical training and your role in education and academia, and how has that training been important in each role?
I guess at the end of the day, we're all problem solvers. And, I think that my background in medicine, health, and public health gave me an orientation to think about how to problem solve, how to prioritize what's most important. And I think those things then carry over. I didn't necessarily ever think of myself as going into education, but I see this as a extension of what I've always wanted to do when it comes to equity and thinking about ways that we can continue to build greater equity in our society. So for me, that through line, whether it's health, whether it's economic development, or whether it's a historically Black college university, I think that through line of how do we make sure that we're at the table, how do we make sure that equity is part of the lens that we see our work, has been consistent throughout.
Wonderful. And then there was a question from one of our up and coming contributors about getting civically engaged. What would be your advice to people early in their career about how to get civically engaged?
Yeah, great question. And I guess I would just say start where you are. So, when I was in college, I was very, well, even back in high school, but when I was in college, I was very involved in community-based efforts that were going on at campus. We did food drives, we did clothing drives. When I went to medical school, same sort of thing. We did a lot of Saturday clinics and hypertension drives in churches or whatever. So start wherever you are. There's always some nonprofit organization or other way in which you can give back. And I just think, for me, always remaining close to community has been important for me. And I feel like my everyday work is civic engagement, if you will. But I always feel like stepping beyond my official job is important, because that's what keeps me close to communities, and that's what keeps me remembering why I did what I did. So I think wherever you are, there's a great program at Spelman, as an example, called Spell Reads, and young women go into the Atlanta public schools and work one-on-one with a young person whose reading scores are low. And it is obviously important for that young person who has somebody who is invested in them and teaches them to read. But when I talk to the young women who do it, their lives are changed as well. So I think it's this, this bi-directional benefit that we get by going a little bit outside of our comfort zone, working with communities. It keeps us close. It keeps things meaningful. And so start wherever you happen to be. It can be a Girl Scout troop, it can be your church, it can be your fraternity or sorority, but there's so many ways to get involved, and the benefits I think, accrue as much to the person doing it as to the individual who you're helping.
Well, that is a wonderful place to wrap up. Thank you so much, Dr. Helene Gayle. We are so delighted that you're going to be joining us in March for the Advocacy Awards. Congratulations again.
Thank you.
On receiving the award. And thank you all for joining us for this conversation today. Any round out announcements from the Research America team? I just want to make sure there are no reminders going forward.
No, thank you so much. We will have an upcoming Alliance member meeting next week, but we thank you all for joining us and appreciate both of your time today. Thank you.
Great. And thank you, Michelle. Wonderful to be with you.
Oh,
A shero in her own right.
Thank you. Thanks so much.
Thank you so much. All right. Take care, everyone.
Bye-bye.
Bye-bye.
Bye.